Everyone, welcome back to PHAMCAST. I'm here still with Dr. Rallis and Dr. Kristy Prouse talking everything about functional medicine, getting real about what it means to actually empower everyday people to take agency of their health. But before we go any further, I got to ask you this, because I know there's people out there dying to know. So dandelions and our health. Why did your mom give you those dandelions? And tell us from a health perspective, what can the dandelion and dandelion root do to help us?
Yeah, well, there's two sort of therapeutic components to the dandelion. Obviously, there's the leaves, which acts more like a diuretic, just generally has an affinity towards the kidneys, and the root, which is more for the liver. But it makes me think of a story. One of my pathologists, or the doctor that taught us pathology, PhD, was an MD PhD, and he worked for many years. This was at Park University, and he worked for many years at Parkland Hospital. Parkland Hospital was the hospital in Dallas, Texas, where JFK went when he was shot. And he'd worked in the pathology ward for 35 or 40 years, done tens of thousands of autopsies. So when we were going through physiology, and this was just a very sort of gentle doctor, spoke in a very, very low monotone. And you'd have to sort of like listen while you're taking notes, because what he was saying was actually just so profoundly important. And I remember him just stopping one time when we were covering the liver. And he said, he stopped, he looked up, he said, I performed, he gave us a number, something, just thousands of autopsies. And definitively, I will tell you, the one organ that determines the quality of your health is your liver. Mm-hmm. Here's where it gets interesting. Think about that. Here's a pathologist that's done thousands of autopsies on patients. The liver is perhaps the most important organ. Hard to say which is the most important organ, obviously, but in terms of the quality of your life, in terms of your health, how many in the entire pharmacopoeia of conventional and modern medicine, how many drugs can fix the liver?
Right. We might say how many drugs are impacting the liver.
All of them. How many can actually fix the liver?
Right. Zero. Right. That's like mic drop. Mm-hmm.
Yeah, that should alone blow you away. Mm-hmm. Dandelion can fix the liver. So can milk thistle. So can hydrastis. And these plant medicines have been around forever. They will reverse liver enzymes. So can curcumin.
Mama Rallis knew what she was doing.
Intuitively, I guess she did.
Yeah.
Yeah, she was, and can help the liver clear. Glutathione, which we use intravenously every single day. Alpha-lipoic acid can clear the liver. Broccoli, cauliflower, indole 3-carbinose, DIM.
Food is medicine.
Can affect the liver.
Yeah.
The fundamentally most important organ, according to pathologists at Parkland, 35 years, not one drug can fix the liver. So if the pharmacopoeia can't fix the liver, but broccoli or cauliflower or dandelion can, wouldn't it make sense that we should be using these foods as part of our primary care?
Without a doubt.
Right. And moreover, if we don't understand them or know how to use nutrition or food or supplements, how can we possibly even provide primary care?
So really what you're saying is, what is the definition of primary care? And this is what I love about this conversation, and really, and I have a tremendous amount, as I'm sure you both do, of respect for my colleagues in allopathic medicine, their training, their experience, and as you have said off camera, there's need for specialties. But in primary care, and it's not the fault of the physician, not only are we looking at time constraints now, but their training, especially a GP, they do not have the opportunity to understand it all. What I love about the work that you're doing and your candidness by which you do it is that you're bringing everyone together. We can all be part of this solution and equation. And as I always say, but the everyday person is the most important member of their healthcare team. So empowering them is the most important part, which is why these conversations are critically important. So let's dive in a little bit. You're talking about IVs, and I certainly know through, Dr. Prouse saving me in my hormonal health when I went through menopause at the age of 39 and really, really struggling. And I've told this on other shows, and I think I might have told you, Dr. Rallis, that I felt like the angels were singing when I finally found her, because I had been to many doctors and specialists, severe endometriosis, years of suffering, and then went through menopause very young and was told it was all in my head. And I'm a type A personality and pushing through. When she looked at my labs, and when I was finally in front of her at the Institute for Hormonal Health, when I finally found her, and she not only validated, but gave me a path forward and kind of looked and went, how are you functioning? I felt like the angels were singing, because now there was some hope, and IV therapy was part of that. Let's talk a little bit about some of the work that you're doing together and the IV therapy that you're providing. DRIPBaR Canada, as I said in your bio, is something you're involved in. I want every Canadian to know about this and how that can help them in their health.
Yeah, the application of intravenous nutrients is very different than oral.
Yes.
In fact, it is a completely different form of medicine. And the best example, in which we can talk about later, is using high-dose vitamin C as a supportive cancer therapeutic.
Yes, we got to get into that.
Partly because vitamin C, no matter how much you take in orally, will never crest to a therapeutic level. In other words, it will never exert a therapeutic effect when taken orally, no matter how much you take, because it's so tightly regulated. So most drugs that, when we were learning pharmacology, you take a drug, if you double the dose, it doubles the dose in your bloodstream. Nutrients don't work that way. So Dr. Prouse is a pioneer in treating adrenal fatigue. Mm-hmm. In fact, when you first started sending patients to us for adrenal fatigue, it wasn't even, it was so poorly understood.
And I want to stop you there, because for those at home, first of all, they may not even know what the adrenals are. Can you give a definition about, what is adrenal fatigue? And I know for those of you that haven't watched our 3-part hormonal health series from 10 years ago, long before this was coming up in conversation, right, you shared your own personal story about why you went into functional medicine as an OBGYN. Can you share a little bit about that? What is adrenal fatigue and why should we care? And then we'll continue that conversation.
Sure. So the adrenal glands are tiny little pyramidal shaped organs that sit on top of our kidneys. They're responsible for producing a lot of hormones, but cortisol is one of the bigger ones. So cortisol is our stress hormone, meant to help us manage with our chronic stress. The challenge is the system can be put on overload and pushed to a degree where it starts manifesting with symptoms like fatigue and sleep disruption, anxiety, depression, weight management struggles. So it's a whole spectrum of symptoms that can be measured and, more importantly, can be treated.
Right.
But it is a diagnosis that isn't typically identified within the conventional medical community. It's cortisol dysregulation, but it's not at the extremes of disease, which are Addison's and Cushing's. Right. So there's this whole middle ground in this day and age where so many of us are on overload, not just from the emotional and psychological stressors, but the physical stressors to our bodies as well.
Right. Environmental. Yes.
Yeah, inflammation, food sensitivities, right? So it's a whole spectrum. And but intravenous vitamin and nutrient therapy plays a really key and important role in managing.
And I might butcher this because your level of expertise in this is so much more, but so Dr. Prouse would look at the cortisol dysregulation, meaning not just what cortisol is, but what is it in the morning? What is it in the afternoon?
Right.
What is it at lunchtime? And then how does it affect the other hormones? So if the adrenals are also affected, we know the cortisol and DHEA, which is another hormone produced by the adrenal glands, will affect cortisol. So right. then she'll look at the DHEA levels and rate those and understand if cortisol is this level, DHEA should be this level. And then, oh, by the way, if DHEA is this level, then also these other hormones, including from thyroid hormones,
right?
Because we're talking about fatigue, she would then look at thyroid hormones, but not just thyroid stimulating hormone, which is tested traditionally like in family medicine, but she would also look at the active metabolites like free T3 or reverse T3 or T4.
Yeah.
And then begin to put all of that picture together and be able to very intelligently and very beautifully begin to put together the treatment plan. And that's what a functional treatment plan would look at. In other words, the cortisol dysregulation, how it affects all the other hormones, what else is happening, plus taking into account the person's life, their nutrition.
Yes.
So when she would send IV prescriptions over, they were very targeted. So it'd be X amount of vitamin C or B5 to restore those adrenal glands. So much selenium for the thyroid if the thyroid was affected. Vitamin D at a certain level if vitamin D was affected. Amino acids if there was to downregulate. And it was just, and I knew that, you know, even though IVs weren't, no, she wasn't practicing IV medicine, she understood functional medicine so profoundly. Her prescriptions were masterful. Right. So, and through that relationship, when I had been working with the American IV Association in the U.S. and with DRIPBaR in the U.S. writing their formulas. So when DRIPBaR decided to expand into Canada, they asked me to be the chief medical officer. And Kristy was one of the first doctors I called and I asked her for help. I said, do you know any doctors that fit this description?
Do you happen to know anyone? Yeah.
And there was this long pause. And and she says, I do know somebody. And she goes, I think I could do that. And I put down the phone. I had this massive smile on my face. I couldn't believe, and we didn't really know each other.
Right.
But we knew our work.
Right. And it spoke for itself.
Yeah.
Yeah.
And I'm so blessed, and with each month that passes in this relationship, it's even better.
Right. Well, you're learning from one another. And in doing that, because at the beginning of the show, what did we talk about? You're here to serve. Who's the beneficiary of that kind of collaboration and constant learning? It's the patient.
Right.
And so we're going to wrap up this segment in a minute, but I do want to ask you this, because I always thinking about the person listening, and I know because I've had IV therapy, what is the patient going to experience? How does it make them feel when they're getting that IV? Like what? Yeah, you can talk about all the technical and the impact that it's having physiologically. What about the patient and how they're feeling? What does that help?
It really depends on what their chief concern is.
Right.
If it's someone that's having...
example.
I'll give you actually a great example from physical medicine or a chiropractic example. I saw a patient that had been seeing our chiropractor for multiple visits, and when I palpated their back, and you would know this as a massage therapist, it was rock hard. And I said, well, I don't know what kind of manipulative therapy could even be attempted at this point.
Right.
So I started an IV. We put in some magnesium, I put in some calcium, a little bit of potassium, I added some taurine to relax the muscles. I said, let's just start here.
Yep.
Called the next day and said the pain is gone. And he had been receiving chiropractic care, and not to disparage at all.
Of course.
2-3 times a week, right? So in that scenario, it was more about using the modality and tuning it, no different than the way you prescribe your IVs for those patients that have that cortisol dysregulation or those hormonal imbalances. So it really depends if it's fatigue, if it's for immune system, if it's for supportive cancer, if they're undergoing chemotherapy.
Right.
All of those things, what we see over and over again is patients that use this modality, especially by providers that understand nutrition.
Right.
You're then able to target the nutrition in very, very unique ways. And it becomes a very powerful modality. And one of my roles when I was with the American IV Association, and still are, and still am, was in reformulating bad protocols. Because it's Wild West. So people were just infusing anything and everything, not concerning themselves with osmolarity or safety or how nutrients interact, and it takes expertise, and we're lucky to be working together, being able to sort of grow this right across Canada because we have expertise and been doing it for years.
Right. And what I love about this, just to round off this segment, and then we're going to come back, we're going to talk about your book, we're going to talk about oncology and IV medicine. But what I love about this is the learning and growing from one another. And you're talking about a chiropractor and me as a massage therapist. You're absolutely right. And that was where Wallis for Wellness organically grew over the years, because I recognized innately that I was just one piece of this greater puzzle, and that we all needed to work better together with one purpose in mind, to change the outcome for that patient. And so this is so refreshing when we get to sit down and talk. Thank you both for being here. I know that your time is valuable, the work that you're doing, and thank you for contributing to preventive health movement. We're going to be back here in a moment. We're going to come back and we're going to talk about IV therapy, but we're also going to take a look at this and dive in. And by the way, I got a signed copy. Stay tuned. We'll be right back here on PHAMCAST.